Next one, laptop, iPad or tab. Very simple. If it is your first choice, so then it has to be laptop. Simple, laptop. Uske liye, you have to get one digital board. Digital board so that you can write. That's something which I'm using right now, right? Go for Yuan. Wacom is fantastic, but Wacom is costly. Again, the range is like if the Yuan is costing 2,000, 3,000 rupees, Wacom will be costing straight away 10,000 plus. But Wacom is excellent. But again, शुरुआत के लिए Yuan is not bad. Absolutely. चलता है, बढ़िया है.
सर वॉकम का ब्लूटूथ वाला ले सकते हैं 9,000 या 10,000 वाला.
बिल्कुल, it is very nice. It is really nice. And for my graphic works, I do have a huge Wacom, right? It's a big one. But they are not portable. फिर वो एक जगह रख के use करना पड़ता है. Something which I'm teaching you right now, it is fixed, right? It's huge one. It is with 21 inches of display, right? I'm writing on that display. Right. So it is not only the digital board, but it is a screen board. So I'm writing on screen and that is getting transmitted to you via OBS. But say this thing will be costing you 50,000. So don't buy that, right? Buy something which is portable, chote, right? So that you can always carry it along with you. iPad, you want to buy, so yes, you can buy for it. By iPad ke liye, don't go for those 1 TB, etc. Right? लाख 1.5 रुपए का iPad. नहीं, अभी वो burden नहीं डालना, right? And regarding the Android, you can take. But इतना रखो कि anything you buy, have that external storage, right? Have that external storage. And this external storage, about say 2 TB का external storage होगा, तो I won't be uncomfortable sending you anything. So very systematically, you'll store those things the way we are storing it into our Google Drive. Same way you'll keep on storing, so that this is like anatomy, then physiology, then surgery, medicine, gynec. You have got the entire material with you. And in that, let's say these are the PDF. Then there would be one more folder, which will be like, say, revision notes. And then there'll be one more where you'll be keeping all those PDFs, which will be for final kill, right? That means the day of the exam when you want to go for high speed. So you are crystal clear right from the beginning that where should I really focus right now? If it is just before exam, you won't be watching any of these folders. Straight away, you'll be heading for this, right? So that way you'll be able to revise it faster. It has to be made very systematically. Right from the beginning, it is exactly like you are arranging your house. The comfort level, that should be the comfort level, that should be the maximum. Means there should not be any confusion कि अरे अब मैं ये चीज कहाँ पे ढूंढूं. Say for example, if these sabji walas or anyone comes, so there is always a problem of chuta paisa, right? So I have put those 3 boxes, right? 3 डिब्बे. बैंक जाके उनको बोला कि ये ले 2,000 रुपए. I want coins. Right? Gladly they will give you. So in one there is 10 rupees coin, एक में 5 रुपए के coin, एक में 2 रुपए के coin, and there is one more dabba with 1 rupee coin. It becomes so easy. There is no confusion. Right? Even in the carry bag, the bag which I carry, दो इसके 3-4 coin, इसके 3-4 coin, it is always there. Anyone asks, why to waste time? ये ले पकड़. And then once you are back home, you replenish. जितने coin use हुए उतने वापस bag में डाल दिए. So at any point of time, there is never ever a problem. Right? So same thing is what we'll be planning. Same thing. We'll keep on designing. I've got in this room, the total data is more than 90 terabyte. Right? There are 3 big NAS, network attached stations they are running. So each with 5 terabytes, and then there is a stack of 1, 2, 3, 4, 5 hard drives. Right? In one, there is a stack of 8 hard drives. But everything is managed in that way that when I want to show you, say for example, say atrial fibrillation, so then I should be able to show you atrial fibrillation, what you hear on your statho, how the patient would look like, what would be its symptoms, and we want to see the real cases. So here it is a CT scan, MRI, everything is into that order, so that I don't have to struggle you to show anything, right? So this is as we approach further. All right. And This one regarding the short focus time, होता है यार, right? It happens. It happens. कुछ नया नहीं है. Yesterday when I heard that, yes, Anand, my friend, right, he got the heart attack, right? I was very much disturbed, and especially when it came to this RCA and LAD. So it happens. But जो last time बोला था, the quality time, the time when your energy level is maximum, don't waste that. तब कोई phone नहीं, कुछ नहीं, no talks, simply focus on the subject and finish it. Finish something which you have planned for today. That is to be finished. बस उसके बाद फिर जो करना हो करो. Games, yes, दोस्त मैं भी games खेलता हूँ. आपने जो email भेजी, right? तो there is one very good game, War Thunder, right? हम register किया है, because you can fly real planes, you can fly, you can move real submarines, and real war scenes are there. You can go for the dog fights. Everything is there. Pretty complicated game. But yes, if you want to fly a Rafale, so it has got all the 187 complete controls. But it would take so much of time, right? They have got very good this training, etc. But सोच लो, मतलब it's like that is not your mission. ये तो just out of sheer curiosity, I installed it. Okay. Is future good? हाँ, so इसके अंदर this is that if you have got time, तभी, otherwise games तो कट करो. Games कितना time खा जाती है, you might even not know. Right. Next. Oh, so many messages. हाँ, it is like talking to girlfriend. बराबर है, बराबर बोले. Tab or laptop, that we talked about. Laptop is always should be the first choice. Right now you focus on these PDFs, absolutely fine. Once you are comfortable with these PDF, then we'll be switching, then you can switch on to say video
Yes, sir.
choice.
Because I was curious about that only. I feel it is better to go with PDF first.
And today what would happen is I'll show you many of the images, many of the tables which are taken directly from the PDF, I mean,
Yes,
from
yes.
the BDC, right? So in that, when you'll go back to this BDC, you'll find कि हाँ ये तो आता है. Something which is extra, right? Something which is extra, because it will be providing some of the stuff जो आगे आएगा, right? But they put it over there, and then brain keeps on remaining in confusion. कर रहे अब ये कब आएगी ये artery, right? कहाँ से आ रही है?
Yes, sir.
So in these PDFs, in our training, what we have really tried is there should not be even 1% of guesswork from where this artery is coming. Today only you'll feel that whatever the things which we'll be discussing, you'll say, ha, we have talked about it, right? When we'll be talking about the spaces today, when you'll be watching the spaces, those who have sent that audio recording, right? They will immediately say, ha, this we can skip. We know this. That would be the feeling. Right? Okay, Abhijit. What about MacBook M4? That is fantastic, right? It is like a Rolls Royce. They're going to
So
provide
for
you.
digital notes, we can use iPad, right?
That's what I'm telling. Say, I do have iPad, I do have Mac Pro, MacBook, everything. I mean, they are super luxury, right? When you write with Apple Pencil, obviously its tactical touch is so advanced and it is so good that there is no comparison with anyone. I mean, the tilt level, the amount of pressure, 256,000 pressure points, etc. So that is fantastic, but it comes at a cost. So what I am replying is in general, right? I won't be telling anyone to beta straight away go for iPad Pro Max with 1 TB of storage. Now तो even 2 TB of storage. It will cost 2,25,000 का iPad आता है यार. क्या? I will call it पागलपन. खरीदो अपने पैसे से खरीदना, डैडी के पैसे से नहीं. सिंपल. अच्छा, if consultancy is going to provide stethoscope, देख लीजिए. मतलब if it is, they must be giving you good stethoscope, right? I'm just guessing it. But if it is, you find it, no, देखने पे पता चल जाएगा, right? What you have to watch is the texture of the tube, right? That should feel very soft and proper. And when you wear it, right, your ear should not hurt. If it is exactly as per your acoustic tube, it won't hurt. अदरवाइज कान में दर्द होना शुरू हो जाएगा. इफ दैट इज हैपनिंग, तो दैट इज द स्टेथोस्कोप व्हिच इज मेड बाय सम अनाड़ी, राइट? इट्स नॉट ओके. वो 2 मिनट के बाद तो दर्द होना शुरू होगा. You won't be able to enjoy the listening, the auscultation. And the core is that chest piece, right? Chest piece. So yes, if they are giving anything good, so you can have it. What about an iPad Pro with M4 chip? And that's what I said, Manasvi, it is the best thing. Athik, no, I couldn't get it. What is of, what are you talking of, cheap quality? I mean, is it Statho? Statho you're talking about, or you're talking about Mac or I? Statho you're talking about. If it is Statho na, तो दोस्त without ज्यादा complication में जाए बगैर ना, spend about 2-3 हजार खर्च लो. Go for any of these. Right? Statho तो अच्छा होना चाहिए. My father told me that always keep your weapons. Inventory should be world class. Right? It should be world class. मतलब अभी से world class means don't take it wrong. कि सीधा जाके लेटमैन का अल्ट्रा ले आए, right? 1-1.5 लाख रुपए का नहीं. That is not needed. But हाँ, as you progress in your medical journey, go for better and better things. जरूर, पर वो अपने पैसे से. हाँ, short focus time we talked about it. क्या है होता है, but जितना भी time मिले, right? It is like if someone tells you that you have got only 2 hours of sleep, तो 2 घंटे मस्त सो लो. Similarly, if you say that okay, मेरा focus सिर्फ 40 minutes रहता है, उसके बाद I feel uncomfortable, ठीक है, kill those 40 minutes. Kill those 40 minutes. 40 minutes is like दुनिया गई भाड़ में. This is my time. Utilize it properly, right? And gradually, automatically, you all will be the masters. कि 3 घंटे 4 घंटे भी पढ़ना है, तो then your focus would be impeccable. Nothing to worry about. Is future good? Don't doubt about it. एक ही sentence में बोल दो, कोई डॉक्टर आज तक भूखा नहीं मरा. But the thing is, study properly, right? Be the solution provider. रट्टा मार के मार्क्स लाने वाले, they are not successful. फिर उनको प्रॉब्लम होती है. Because when they go to hospital, when the cases are in front of them, पसीना निकलता है AC में. Right? And I'm not very sure about the internship, but the way we did the internship, that you are sent to one village, वहां भेज दिया. There is only one PHC. PHC is Primary Health Center, and you are the boss of that Primary Health Center. Under you, there'll be 1 or 2 compounders, there'll be 1 or 2 nurses, right? And आपका मुंह देखेंगे जब कोई पेशेंट आएगा, सर क्या करें? And now you have to handle it. Right? First 3-4 days, तो हालत खराब थी. Because my posting was in Bagodra. That is a place where there is a road which is like this, a sharp road. यहाँ से full fledged speed में गाड़ी आ रही है, यहाँ से आ रही है, and head on collision. And this was the place of PHC. I mean, in first week only, there were 4 cases, 4 major accidents. मतलब सारा medical निचोड़ के आ गया. But then that is what teaches you. Learning stock market, my dear, अभी stock market नहीं. I'll teach you, right? सबको बोल रहा हूँ. It is very tempting, right? But loss भी ऐसा ही होता है. ऐसा ही होता है loss. जब loss शुरू होता है, तो then it is very difficult and it captures your mind. So अभी मत. What I said is that once you cross the age of 18, right? You just open your DMAT account. You open your bank account first, right? Your own personal bank account, because that would be needed. You will be requiring your PAN card again. That PAN card, what is needed once you cross the age of 18. And uske baad PAN card. And then you will be requiring a DMAT account, right? Your DMAT account should not be from the bank. Because say, for example, HDFC, then there is HDFC Securities. HDFC is a bank. HDFC Security is a stock part of the bank, HDFC. But their brokerage is so high that you won't be earning anything. So that's why you can go for any of these things, right? जब खोलना हो मुझे बताना, right? I'll suggest you where you'll be getting free, zero brokerage. There is no brokerage. That is something what is needed. They say that they don't give you the services. किसको चाहिए service? We don't want those services because now the entire platform is digital. I am using that, right? I can pay that brokerage, पर नहीं, जब खुद ही शेयर बाय करने हैं, खुद ही बेचने हैं, we don't want anyone in between. The way we say mutual funds, in mutual funds there are two things, one what is called as the regular, second is direct. They say कि नहीं हम आपको सजेस्ट करेंगे, ये करेंगे. अरे बॉस मुझे आता है पढ़ना. I can teach you. Just after 1 hour you'll be able to take a judgment कि मुझे ये mutual fund लेना है या नहीं लेना, right? There are softwares available, free, right? You just input that data and it will show you the chart. Right? What is called as the daily moving average, 50-day moving average. It is called as DMA. And I'll teach you all those things. So in 1 week, you won't be requiring any of the financial consultant. वो बड़ी-बड़ी बातें करते हैं, fancy words use करते हैं, but core is that simple, right? So अभी के लिए थोड़ा relax. I know you want to earn, but yes, अभी time है मेरे पास, right? Regarding want to meet, we'll plan. Right, we'll plan definitely. But abhi to we focus on this. Ye mat bolna, right? That life should be like you because you don't know my entire life, right? Sometimes what we watch is finished product. पीछे कितनी तकलीफ थी वो नहीं देखते. Right? So that's okay. But I appreciate what you wrote. Thank you. Regarding notes, physical and digital. Regarding physical and digital. Sorry, just a minute. So regarding notes, physical or digital, I would say digital is good. As we discussed, can take multiple copies of that PDF, ठीक है? But कुछ notes physical होनी चाहिए. क्योंकि हर बार रात को, as I said, for a better sleep, you should be avoiding all those screens at least 1 hour before you go to sleep. है ना? अब तब पढ़ने का मूड हो तो तब वो फिजिकल नोट काम लगेगी. सो फिजिकल नोट कैसी होनी चाहिए? डोंट वरी अबाउट द ट्रीज, यार इतने पेपर यूज हुए, नहीं. एक पेज उसके ऊपर those important keywords, important diagrams. I'll show you one diagram today, right? That diagram, so that there is no effort. You are just watching it effortlessly. देखा और लगा कि बस अब नींद आ रही है, बंद किए सो गए. If you feel like कि चलो मुझे 2 पेज पढ़ने हैं तो 2 पेज पढ़े. But one page, it has to be independent, second page independent, nothing connected to each other, so that you can cut down at any point of time. I'll be back in a minute. Just that person is there. Just a minute. Yeah. Okay. So that solves this problem. Okay. Straight away now we'll start with.
Hello, sir.
हाँ बोलो.
Can you just show that screen again? I want to take a screenshot of it.
अरे, I'll be giving you this PDF only.
Okay, all right, sir.
Right. This is a PDF which I am saving parallelly. You got that link, na, Manasvi?
Yes, sir. Yes.
Bas. So you will be getting this PDF only. And every time this would be our practice. Whatever we discuss, we'll be saving this PDF, we'll be saving that PDF so that you get it.
All right, sir. Thank you.
Okay. Acha. I think, yes, I talked about, I don't have any of the thing like laptop. In that case, go for laptop, right? Very quickly. Repeat about the devices. I joined late today. Riddhima, I said that initially you just go for the laptop. In case if you got the laptop, if you want to go for any of the mobile devices, so then you can go for iPad or tab. But as far as possible, if you got the laptop, so then at least buy this digital board, right? So that you can write, so that you can take the digital notes. It would be very crucial as you'll be making multiple versions of the same PDF. In one version, everything is described. In second version, less. Third version, so it is having only the keywords or only the diagram, something which you'll be using for your revisions. Then, what is the quality difference between them? I think you might be talking about Statho, right? The difference is its listening capability. So I'm not going into right now the details of that which sounds are heard better, because it's like we'll be spending 1 full hour on that only. So just trust me, the the this and this, right? You can buy any out of these three models. Say EL 160, that is also okay, but no, it's just too cheap, right? So I won't suggest. I mean, so there is, as such, it is 650. So just for 1,000 rupees, right? There is no point in spoiling the audio quality. So I won't suggest that. हाँ, बाद में we'll discuss in detail. Otherwise, हाँ, 19 plus, तो बिल्कुल you can open those accounts. But एक संडे को रखते हैं, right? Because now there are so many questions coming up for finance part. We keep one Sunday discussing that. Else we'll be losing the today's topic. ठीक है? RCSP, that is okay. That is also a good system. Yes, वो अच्छा है. अच्छा, now the questions regarding finance, we won't take it now. हाँ, now we won't be able to take it. We'll keep one Sunday, right? We'll keep that Sunday session open. Whatever the questions which you want to ask, no restrictions, whether it is on fitness or this, that. Let's start with the scapular region. Scapular region, very comfortable. And trust me, today you'll be getting answers of so many of your queries. You might have noticed that I haven't replied to you regarding that audio, right? So many of you have asked questions that we were not present on that day. So what audio are we supposed to send? You'll get the answer today, right? Plus, there were few confusions regarding teres major, teres minor, some confusions regarding the subclavian artery, some confusion about the axillary artery. All will be solved today, right? Let's start with the scapular region. When we say scapular region, basically we are talking about the shoulder, right? We're talking about the shoulder. And that shoulder, which will be having two important bones, obviously the scapula and the humerus, and in humerus upper, and no big rocket science, right? We are talking about this upper part. ठीक? So moving further, here it is. All these things known to us, right? And what is it? We know clavicle, we know scapula, we know humerus. But our focus straight away, we are going for the greater tubercle. Sorry, the greater tubercle, this area, greater tubercle. This greater tubercle, that is the lateral most bony prominence. So when we lateral most, right? So this upper is what? Upper is your scapula, right? Acromion process, right? When you put your hand over here, lateral means from side. From side, just press deep, aha, right? You'll get nice pain, right? Something which is very comfortable, right? So when you do boxing, after boxing, when you press this, you feel good. So this is the lateral most bony prominence, and that is what is called as the greater tubercle. Cutaneous supply. Cutaneous supply means that this skin which is over that area, that is supplied by whom? That is supplied by upper half and the lower half. Important? Very, right? Its importance would come. Say both are lateral. Yes, both are lateral, right? This lower one is lateral cutaneous nerve of arm. Lateral. Now this arm has started, brachial region has started, right? So we are talking about right now this. Name is, close your eyes, think it like cutaneous. Yes, this is cutaneous. Lateral, yes, it is lateral. This is arm, yes, this is arm. So then done. Lateral cutaneous nerve of arm. So this part is no brainer, right? No tension, easy. From where is it coming? Just see that. Then this is this upper half that is near this clavicle. So this is lateral supraclavicular nerve, right? Makes sense? So this is just to remember. Posterior part, this back part is by dorsal rami of T1 to T3. Dorsal rami, what was that, right? Here is a spinal cord, right? And we talked about two things. There was a posterior horn, there was anterior horn. From anterior, what was coming out? From anterior, what was coming out? Motor supply, right?
Motor.
Yes, motor. So the cutaneous part means the sensory part. Sensory part is from the posterior part, right? So they are called as the rami. Rami means branches. Ramus, branches. Plural, singular, a plural. Singular is ramus, which is branch, right? When it comes to behind, it is called as the dorsal, and when this is called as the ventral, right? Ventral. So they are also called as the ventral rami and the dorsal rami. Dorsal rami or the posterior rami or the posterior branches, they are all right. They take the sensations. So that's why we are talking about that. These are the dorsal rami, which will be carrying, right? Which will be supplying the T1, which will be supplying the posterior part of this greater tubercle that is over here from T1 to T3. T1 to T3 level comes, right? Now the thorax has started as such this region. So that's why T1 to T3. Cervical, they are up. Ekdam easy part, right? Everything is labeled. So in that video, I asked that, okay, 1, 2, 3, 4, 5, 6. These are the 6 muscles. Identify those muscles. No problems, right? This is yes, you know, this is the deltoid. This is the deltoid. Then this deltoid has been made a bit transparent so that you can see the muscle which is over here, right? So which is coming from the top, the supraspinatus, right? Then supraspinatus. Then infraspinatus, obviously, we won't be able to see. It is posteriorly. That's right. This one is posteriorly, right? Then we have got the teres minor and the teres major. Now you are masters of teres minor and teres major. So this is the teres minor, which will be remaining in the back side. And this is the teres major, right? Which is coming over here, right? Which is into that groove. And what would be attached here? This is teres major. What would be attached here?
Pectoral major.
Pectoralis major. That's right. And in between there is
Lats.
Very good. Shabash. Right. And this is the subscapular, the sandwich one. The subscapular, which is between the scapula and the thorax or beach mein se, right? It is coming. So bas our entire discussion for today will be rotating around this only. Which muscle is this? This one?
Scalenus anterior.
Shabash. Very good. Who said that? Shabash.
For me.
Good. Very good. Right. And this one would be
Scalenus middle.
Scalenus medius, and this one would be the scalenus posterior. That's right. And how do we identify? Why are they important? Because the brachial plexus and the arteries, major arteries, they will be coming through the window between the scalenus medius. Right? Its importance will be enormous, especially when we'll be discussing the head and neck, right? Head and neck. But a choti si important cheez thi, that was the cervical rib, if you remember. Cervical rib. No? Normally rib comes, this is the first rib which comes from the T1, thoracic 1, right? Vertebra thoracic 1, first thoracic vertebra, this first rib is there. What if the rib is coming from the cervical one? So if it comes at this level, when it comes at this level, obviously it will be compressing the brachial plexus and it will be compressing the vessels, and it can lead to so many complications, right? Depending upon whether it is unilateral, bilateral, how big it is. Normally, even if it is present, it is very thin, right? And in upper limb only, I'll be showing you those x-rays. As I promised, right? I'll be showing you those x-rays with the cervical rib. But at that point, I won't tell you that this is the x-ray of cervical rib. You have to diagnose, right? You have to diagnose. So, abhi se bata raha hu, right? I'll tell you कि इस patient के sign symptoms क्या हैं. You love it. Today, you'll also be getting a small feel of CT scan. Achha. Here it is, quickly. 4 things in this region which are to be understood very properly, and they are the actions. Now, during learning any of all these actions, if you do it along with it, then it would be very easy for you to understand. We are starting with deltoid, right? The deltoid, one of the important muscle, right? one which is giving curvature to your shoulder. So this deltoid is divided into three parts: the anterior deltoid, the posterior deltoid, and the middle one. Quick, big rock, no big rocket science. This anterior one, when it is anterior, right? Obviously, when it will contract, so it will take the hand near, right? It will take the arm near. So here it is. First, let's see where it is attached. So here it is, first part, right? This is our clavicle. Yes, on the clavicle, on the lateral side, right? Lateral 1/3. So this we can forget. We know that it is lateral, but it is lateral 1/3. Right? In exam, they do ask, right? Lateral kitna, lateral half or lateral 1/3. It is lateral 1/3. So that's why in our notes of revision or in our notes of late night notes, right? Just before sleep, we'll highlight only this much 1/3. Baki ka to yaad rehta hai. Right? So this is lateral 1/3 of the notes. One email which you said that can we draw the images? Well, I got one book also. In case if you are interested, I'll share that book today only. You where it will show you drawing of all these anatomical drawings, right? I mean, if you want to draw it artistically, but even nahi hoga na to bhi, if you just do it like this is like, let's say, clavicle, and this is lateral 1/3. ऐसा draw करना हो तो भी you'll be getting good help from that book. मजा आएगा, you'll enjoy it. ठीक. So खाना खाने के बाद when you feel sleepy, so then take a book and scribble some images. So you'll love it. I'll share that book today. Then it comes to middle deltoid, right? Middle deltoid, obviously. But this middle deltoid, it has got one speciality, and that speciality is, one, it is connected to acromion process, obviously. तो और हो ही है क्या? क्योंकि यहाँ पे when we touch on this tip, right, the flat portion which we feel, that is the acromion process. So the fibers will be landing directly. So that is the acromion process. But there is something extra. When you dissect it, so then you will find that there are septas, right? These are the septas. Now, this deltoid is one of the very powerful muscles. Why it is powerful? Because in small space, it has got multiple fibers. The thing is, number of fibers, they are always important because number of fibers governs that how much is the strength of that muscle, right? So here, this is called as the multi-pinnet muscle, because when the tendons are in between, then from every tendon, right, see, they will keep on coming. So thus, this will look like as if it has got multiple feathers. So this is like a multi-pinnet muscle. More number of muscles, more number of fibers. So this is for higher strength. So that is the middle deltoid. And this is again the posterior one. Posterior one, piche kya tha? Posterior, the moment we touch, yes, that was the spine and full spine, right? So crest of spine is used, and that is the spinoschapula, and that is what it is taken by the posterior one. Okay. A short important point on this multipinnet. Multipinnet means there are 4 group of fibers on the top, and in the bottom, where when it is inserted, there are 3 groups of fibers. That means those fibers, they will be focusing concentrated on one point. So that is the point where they can generate large amount of power, right? All those who are going to gym, right? We take the dumbbells and then we do this exercise. But if you take your hands absolutely on sides, right, and you just rotate, this will be one of the much better exercise, because as we'll proceed, we'll see that there is rotator cuff muscle, right? So they will be protecting your shoulder, and at the same time, when you are moving your hands, right, in circle, so it is taking care of anterior fibers, middle fibers, and the posterior fibers. And plus, when it is with weight, right, it is one of the best thing. 36 chamber of Shaolin, right? Thanks. In the chamber 4, this thing is shown. It lands on the area, what is called as the deltoid tuberosity. Tuberosity, right? Remember, when it comes to tuberosity, that means naam sunne mein pata chalta hai, right? Gunde jaisa naam, it is a rough surface, right? On the bone. Next time we'll be watching only the bones. I'll show you only the bones. And in that, the moment you will see tuberosity, to aisi rough area. It is rough because such a powerful muscle is landing over there, and it can generate so much of power, more number of fibers in less space. So that's why it will be creating a very prominent impression. Such rough areas, they are used to make a judgment between, in forensics, when the bone is in your hand, just to figure out whether this bone is of male or female, right? Now, say for example, if you are watching the bone of Azarenka or Martina Navratilova, so that would be even better than the males because their physical power is that high, right? But this is in general. हाँ, बस पार में आ गया सब कुछ. Posterior cord, right, will be giving axillary nerve and will be giving radial nerve. This is what we are watching. एक second में you come to know that yes, this is the posterior cord, right? क्योंकि तीन, we are getting the three divisions. 100% it is posterior cord, and in posterior cord there is one nerve which is going, this nerve which is going towards the area of our interest today. So that is the axillary nerve, C5, C6, correct? C5, C6, which is branch of posterior cord, and that is what is going. Here it is a zoomed version, right? Posterior. So these are that is the posterior cord, and here is the axillary nerve, right? This axillary nerve, as it proceeds further, right, it will be going into the neck, and that is called as the surgical neck, right? You remember this, right? We call that thing as a surgical neck. So that is the surgical neck of axilla, surgical neck of humerus, right, which is into the axillary region. Then obviously this thing will continue as a radial nerve, and this radial nerve is big. That's why it will be putting impression on your humerus. That would be called as the radial groove. So radial groove, ये कल बात करेंगे, next time बात करेंगे, right? But this radial nerve, as it goes down, it goes near the shaft, right? Because आगे जाके this is the upper, so this would be the shaft. This would be the shaft, and this nerve will be going over there until it put a groove in this, right? Very nice, so that this nerve feels protected. But what happens when this is broken? If there is any lathi, मारे किसी ने यहाँ पे, and the bone is broken, so yes, the radial nerve will also be sacrificed, right? Because it is in groove, there is no point, so it becomes like a sitting duck, and it is sacrificed, right? Anyway, it will come again, but just because it was coming in way, so I told about it. This axillary nerve, and last batch, this gave akapaka. Akapaka is anterior circumflex humeral artery and the posterior circumflex humeral artery, right? So this ye name unhone, this was given by them. So for the entire upper limb discussion, we used to call it akapaka, right? So these are the two branches, but axillary nerve will be associated with posterior circumflex humeral artery, right? Because every time there would be one artery and one nerve, which will be accompanied, and they both get damaged whenever there is any of the fracture, right? Fractures, they will be indicated by this, right? That's our scapula. So whenever this is the axillary nerve, right? This is the axillary nerve, which is shown over here. This axillary nerve, along with the posterior circumflex humeral artery, that is going onto this surgical neck, right? So this is the area. This is the area of middle deltoid. Now, whenever you'll be giving injection, intramuscular injection, remember two things. If the injection is to be given on the shoulder, kabhi aise nahi. Right, I've seen people straight away 90 degree pe ghusa denge, and that thing straight away hits this axillary, and then suddenly this shoulder contour is lost. No, just that shoulder contour is lost, right? Round contour that is lost because it damages the deltoid, and person shoulder abduction, right? Now, कौन सी बड़ी बात, right? This is the middle. When this muscle contracts, right, this will be leading to shoulder abduction, right? That power would be lost, right? So they'll say कि sir हाथ ही ऊपर नहीं हो रहा, and then there is a pain, there is swelling. Plus, just by the looks, you'll know that it is flat. It has become flattened. And then when you touch it, they'll feel कि नहीं कुछ feel ही नहीं हो रहा, right? So that is when sensory loss is there. And that's why this is called as the regimental badge. That is whenever, say, in your, as per your position, right, the badge which is put, that badge, it is put over here, right, lower portion. That's why this area is called as the regimental badge. So in this regimental badge, the sensory loss, inability to abduct the shoulder, and the contour is lost, right? This is when the injection is given 90 degrees. So how will you give the injection? You will hold this area, right, like a fold, right? You will hold this area. When you are holding this area, that means you are gripping only the middle deltoid. And then at 45 degree, you let the needle go. And then just take it slightly back. Why you are plunging it back? So that you know that you are giving intramuscular, not the intravascular, right? So by chance, if the needle has entered into any of the artery, you just pull it back, you find blood, then you withdraw the needle slightly, right? So that you are sure that you are not going into the vessel, and then you inject, right? It will be landing into this middle deltoid, comfortable, no problems. Patient won't be having much of the pain if it is given properly. But when it'll come to, we'll discuss that thing in lower limb, when it will come to lower limb, the injection, that needle, that should be going 90 degree. It should not be going at an angle, because over there also, there would be a big nerve, that is the sciatic nerve. We don't want to damage the sciatic nerve, right? We'll discuss that thing when we'll be coming to lower limb, but this is what is needed. Right? The chances of getting this axillary nerve injured by the intramuscular injection, that is very common. Here is the axillary nerve lateral view, right? From lateral side, it is just popping out, right? It is just popping out. Lateral view. This one is the posterior view. Now, as we see, so from anterior, it is coming down to posterior side, and that's why it is associated with PACA, right? Posterior circumflex humeral artery. ये nerve आगे नहीं जा रही, right? This question is sometimes asked in Viva, that why not anterior circumflex humeral? Because anterior circumflex will be coming from anterior and posterior from posterior. That's where they both would meet. This axillary nerve is associated with posterior circumflex because it is coming posteriorly. And this area is the surgical neck. Okay. Next one. This is anterior deltoid. Now, this anterior deltoid, what is the function? This is anterior deltoid. Now, once you do it along with say this discussion, you'll find it very easy, because the muscles ka aisa hai, when they contract, you feel that contraction. So deltoid, which is divided into anterior, middle, and the posterior part. In the anterior part, when this contracts, right, so then it will rotate. So this is like a medial rotation, right? It is the written over here, medial rotation of arm. So when the medial rotation is to be done, it is like this. This is how the muscle would contract, not like this, right? Because if the whole muscle is contracting, it will lead to this flexion, right? But when it is synchronously contracting, it will give a rotation, right? So that is medial rotation. So these muscles, imagine how beautifully they'll be supplied by the brain. That brain sends them wave, right? So the muscles, they contract like this, and it leads to medial rotation. Same way for the posterior, when it goes for the external or the lateral rotation, right? So that's how it goes. So this is first action, medial rotation. When you do the medial rotation, you just put your hand over here and you feel this muscle is contracting. Just a minute. Seriously, you guys are so good because every time there is some disturbance, but आप सब आराम से बैठे होते हो. There was one I ordered. I tell you what was it. I ordered one 16 ampere plug, which should be controlled with Alexa and Google. And what really happened is that when it came, right, there was one error, and that error was one of the terminal that was loose. So at times it was working, at times it was not working. So that's why this was like an exchange. So I had to check that the new one which is supplied is okay or not. So now it is okay. Okay, so this is anterior, middle, posterior, and you feel that yes, that's right, that it will be giving for the medial rotation of arm. The next one, this is the anterior deltoid actions. The transverse adduction of shoulder. So when the shoulder is over here, this whole muscle contracts back, right? It will take back. But you might say that won't it be like even pectoralis major will also help? Surely it will help, right? But right now we are just focusing on the deltoid. But yes, any of the movement, many of the movements, they are not like a singular muscle movement, they are the associated one. So especially this transverse adduction, when it is there, right? So it will be by the anterior deltoid, but along with even others also. So we talked about two actions, one medial rotation and second is plus, and this is the adduction, right? ये revision के लिए. So during in your revision notes, you won't be writing medial rotation. So this M and then this done, this is medial rotation, right? So, and when we write this plus N, so this is adduction. When it would be abduction, so we'll be writing like this, abduction. So this is how you can increase your revision speed. On to this next one. This is shoulder flexion. ठीक है? Shoulder flexion. The muscle is there, it contracts and it flexes, right? So thus we have understood medial rotation, transverse adduction, right? And third one is the flexion. So that's how this muscle group is working. On to this middle deltoid. Middle deltoid, very easy. It will be shoulder abduction, right? Because it is right in the middle. And as it contracts, obviously this will be going for shoulder abduction. So that's for revision, abduction. And regarding this posterior, if anterior was for medial rotation, obviously the muscle which is on the back side
Lateral.
will be for the lateral rotation. That's right. So this is for the lateral rotation, right? Lateral rotation. And so this is three actions of anterior part. This is the middle one, which is the abduction, and the posterior is for the lateral rotation. The next, right? So posterior deltoid, also the shoulder extension, reverse of shoulder flexion. If anterior is going for flexion, पीछे वाला खींच के to take it back, right? So this is called a shoulder extension. But one extra thing which we'll be adding, what is called as the hyperextension. Hyperextension is that when this is flexion and it comes to the neutral position, it is called as extension. But when we take it back, right, so that is what is called as the hyperextension, right? When we take it still further back, right? So that is what is called as the hyperextension. Remember this. And posterior deltoid, that is again shoulder transverse abduction, right? So if anterior was doing adduction, then posterior is taking it away, right? So that is the transverse abduction, right? Anterior and posterior, their actions, they are just reciprocal to each other. On to the supraspinatus, right? All-time great supraspinatus. You know that origin supraspinous fossa. This entire fossa is supraspinous. That's the spine. So supraspinatus fossa insertion is on greater tubercle. Yes, greater tubercle. Now today,
Sir,
greater tubercle.
Sir, fossa means depression, na?
Fossa means depression. That's right. Fossa means depression. Depression. Right? That's the fossa. So, and why that depression occurs? Because see, the muscle is attached, so that's the bone takes the shape so that muscle can rest over there. That's why that fossa is created. Because initially, these bones, they are very flexible, no? Very flexible. So when the muscle does the dadagiri, and then they create a space for it. But when we watch the bones, the muscles are removed. So we find there is khadda, there is fossa. But that fossa was created actually by the presence of muscle. So bigger the muscle, bigger the fossa. Right? Where it is attached. So if that area is rough, so that means a very powerful muscle was attached. Right? So this tubercle is a small space, but we are telling that there are two tubercles. One is bigger, one is smaller. Now suddenly this greater tubercle will become like a VIP. Let's see what happens. We said insertion is on the greater tubercle. Okay? That is the supraspinatus, above the spine. On to the next one. There is one more muscle, right? Again, yes, you know, this is infraspinatus. In infraspinatus, there is infraspinous fossa. That's right. Again, it is going on greater tubercle. But difference is over here, middle part. Over here, it was the
Upper.
upper part. That's right. So this means this greater tubercle is something which is very interesting. Right? So here it is, right? That's the greater tubercle. Upper part and the lower part and the middle part. So this is middle part. So then there has to be the lower part, right? Yes, that lower part. That is where there would be teres minor attached. Now you know that supraspinous, infraspinous, and teres minor, they all are landing on greater tubercle. Greater tubercle, right? Second thing, teres major kahan pe? Teres major into that groove, that lip of the groove, right?
Medial.
Yes, medial lip of the bicipital groove. And then there is subscapularis. Subscapularis, you know, that sandwich muscle, right? So supraspinous, infraspinous, teres minor, and the subscapularis, these four muscles, they form what is called as the rotator cuff muscle. Rotator cuff muscle. Cuff means hatkadi, right? So that hatkadi is always like this. There is one area over here, it is open. So these four muscles, they will actually be forming the entire area, and they prevent the dislocation of the shoulder. Right? Dislocation of the shoulder. Sirf ek jagah nahi hai protected, and that is downward. This is the reason that all others, they are rarity, right? Shoulder getting dislocated on the upper side. It's not like it cannot happen. If there is acromial fracture, so then it can. But it is a rarity because it is well guarded by those big giant muscles. But lower, there is just one capsule. So that's why it can dislocate below. Downward dislocation is the commonest, right? Though this question is of ortho, right? It will be asked in ortho, not right now. But just to know that why the downward dislocation is common, right? Dislocation of shoulder or humerus, right? Downward dislocation of humerus is commonest. Yeah. Now you know this part. This portion, right? This portion is supplied by. We are going back to our brachial plexus, and today brachial plexus revision will be automatic. Right? C5, C6. Yes, we know this C5, C6 root, and then it will be forming the upper, right, trunk. From upper trunk, there is one branch which is called as the suprascapular nerve, right? Suprascapular nerve, and then there is one more branch which is now to subclavius, which was going and supplying to the subclavius. Subclavius, which is a muscle which is just underneath the clavicle and which is supporting those, giving steadiness to the clavicle. At the same time, it is supporting those blood vessels and the nerves. Right? So this is the nerve, suprascapular nerve. Suprascapular nerve will be supplying this supraspinous. Right? Not only that, right? Here it is. This is the nerve supply, suprascapular nerve. That is supplying even this infraspinatus. So now we straight away know that in case if suprascapular nerve is damaged, it would be affecting medial and lateral rotation. it would be affecting the lateral rotation, right? Because it is supplying supraspinatus and infraspinatus. That is all the backward movements, they will be affected. So this is one. This we have already talked about, scalenes, right? The scalenes. So C5, C6, the nerve which is going above, it is supplying supraspinatus and infraspinatus, and the nerve which is going below, that is, its name itself is nerve to subclavius, right? So that is done. So we have finished talking about infraspinatus and supraspinatus nerve supply. That is supra.
Sir,
Now,
so the injury to the thyrocervical trunk means in general, like suprascapular nerve. So if that
yes,
is damaged, then lateral motion is
lateral
disturbed.
motion is affected. Yes, that's right. That's right. Achha. Now we introduce the third muscle, the muscle which we have already talked about, right? Upper is supraspinatus, infraspinatus, and the lower one is apna teres minor. So that's the teres minor highlighted over here. That is the teres minor. Teres minor's origin, upper 2/3 of the dorsal surface of the lateral border of scapula. Arre chodo, itna complicated kyun? Right? It is so easy, right? Scapula. So that was the scapula. Supraspinatus was here. Spiny. Infraspinatus done. So then that border which is slightly left out, right? This border which is left out, upper portion, right? Upper 2/3, that is by teres minor, and the lower one, that is by teres major. But that's the thing, right? So they are coming from the edge. Dorsal side, so that is the posterior side, dorsal surface of lateral border of scapula, right? So if this is the scapula, so this is the dorsal side, that means posterior side. This is the lateral edge. This is entire lateral edge. In lateral edge, upper 2/3. So this is the upper 2/3. Upper 2/3 is teres minor. And this lower 1/3 will be apna teres major. Bas, simple, right? So when they write it in running sentence, it looks complicated, but as such, it is simple. So here also, this is the greater tubercle, lower aspect. Watch the whole thing as one piece. The greater tubercle, upper, middle, lower. So then that is supraspinatus, infraspinatus, and the teres minor, right? And then what is teres major? No, teres major to aage jayega, right? That's why now it is like one mail where you said that you are confused between how the teres major is going out, because from here, right, you just see it, beach mein se nikal ke it has gone all the way to the medial lip, right? Medial lip. Obviously, it cannot go on lateral lip. Lateral lip pe gaya to pura bicipital groove hi cover ho jayega, so then no one will be able to connect to it, right? So it will be connecting to medial lip. आगे से pectoralis major connect हुआ, and बीच में से bicipital groove में से latissimus dorsi, right? So that's the latissimus dorsi here. We have seen that also. So see the latissimus dorsi that is going over there, teres major, which will be on lower lip, and that's how this will be connected. Now, just for the understanding, we remove the infraspinatus, right? When we remove the infraspinatus, so rest all, they are kept as it is. So here we can see the teres minor, right? This is the upper 2/3 dorsal surface of lateral border scapula. Yes, we know that, and greater tubercle. And this is the point where we see axillary nerve, right? Which is coming from the posterior cord. Another nerve is radial nerve, which will be going downwards, right? Lateral rotation of the arm, that would be affected in case if anything happens to them. Here it is, see, these nerves, right? The nerve which is going down along with the artery. So that's now teres major. The discussion which was done till this point, it has made teres major easy. Lower 1/3, yes, lower 1/3, right? Lower 1/3 where? Well, the dorsal surface, posterior surface of lateral border of scapula and inferior angle. Yes, that's extra, right? This portion is called as the inferior angle, right? Ye portion. That is this portion. It is called as the inferior angle. Inferior angle. Scapula is a triangular bone. So that's why this area, that is sometimes called as the lateral angle. Similarly, the scapula will be over here. So this area can be called as the medial angle, right? Because scapula is a triangular bone. But medial और lateral की बारे में बात कम होती है. mostly this inferior angle that people are very much interested in, because what is the importance of this inferior angle? Anyone?
Surface anatomy.
Hmm?
Surface anatomy.
Sorry. हाँ, surface anatomy तो ठीक है, बहुत complicated है, मुझे समझ नहीं आता. Inferior angle का रोल क्या?
PAV
शाबाश. Very nice, very nice. This is the inferior angle, because जब patient ऐसे खड़ा है, right? You will be telling, put your hands like this.
P7 spinous process and C8
Right.
body.
Very right, very right. Right. So those inferior angles, they will be seen clearly, even from the distance. So you take the X-ray tube, right? And then there is a marker, right? There is a centralized projection. So when you switch on the light, so there will be this hairline, and you just focus it between exactly two inferior angles so that your X-ray would be absolutely perfect, right? So that is what is called as the point of centralization. That is the point where you'll be setting the X-ray beam, right? So that is the importance of inferior angle of scapula. Here is the quick, very fast, quick revision of the brachial plexus. In this brachial plexus, C5, C6, right? So these are the vertebrae. There is the vertebra C5, C6, C7. There is no C8. Then the T1 and the T2, thoracic, right? The rule is that above. Then now which is coming above, that is the name in case of cervical. So this is coming up. This root is called as C5. This root is called as C6. This root is called as C7. This root, we should call it T1. No, but the rule changes in thoracic. In thoracic, the branch which is coming below is called as that. So this is T1. So this will be called as T1. Below it, if there is any, there is a now, then there is a branch, so it will be called as T2. So what about this bichara, one who is nowhere? So then we gracefully we say you are C8, right? So this is the C8. C5, C6 join together, C7 is direct, C8, T1. Ram to dur chala, this is root, right? They form the trunk. So this is the upper trunk, middle trunk, and the lower trunk. They divide into divisions: anterior, posterior, anterior, posterior, anterior, posterior, right? In case of this upper trunk, there is suprascapular nerve and the nerve to subclavius, which we discussed, right? Which we discussed. Then they are divided into anteposterior, anteposterior, anteposterior. Then the medial, which has got just one root, lateral, which has got two roots, and posterior, POSTERIO, more number of alphabets, so maximum number of roots, so three roots, right? So that's how they will be making what is called as the cord. So we have got the lateral cord, we have got the medial cord, and we have got the posterior cord. In the posterior cord, in order to remember it easily, we remembered par, right? Par, and two M's never meet. So that means this is posterior, so it will be giving this axillary artery, axillary nerve, and the radial nerve, right? So these two majors, they are done. The second one, which is very much important, is the musculocutaneous. M won't meet, so that's why musculocutaneous will definitely be coming from the lateral cord. Only which is left out is the ulnar one, right? So this is the part of the medial cord which gives this ulnar nerve. But then there is a joint operation, and that is called as the median nerve, where lateral would contribute and the major contribution will be coming from medial. So that's why that medial root and the lateral root, they form what is called as the median nerve. Done, right? Most of the things are done. 2-3 things which we remember. From the lateral cord, there goes the lateral pectoral nerve. From medial, there goes the medial pectoral nerve. Medial pectoral nerve. This lateral pectoral and medial pectoral nerve, they supply one big muscle. Which muscle is that?
Pectoralis major.
Very good. Pectoralis major, right? It has got the dual nerve supply. All right. On to the subscapularis, sandwich muscle, right? So origin is subscapular fossa, right? You're right, that depression, big fossa, and it is landing onto lesser tubercle, right? So this was the greater tubercle, and then there is a lesser tubercle. So in this area, in this lesser tubercle, it lands, right? So this is also a multi-pinnet. Simple rule. When it is a fan-shaped muscle, right? When it is emerging from such a big area and focusing only on smaller one, so obviously it has to focus. So that's why this becomes a multi-pinnet muscle. So upper and lower subscapular, right? Now we saw that. There is from the posterior cord. There is another one which is thoracodorsal, right? It will come. So this one, which are the structures which are under the cover of deltoid? This is one of the theory question. What's the big deal, right? We start with the bones. In case of bones, right? Deltoid, when it is over here, the upper end of humerus, coracoid process, right? All those things, they are covered, right? Fine. For the muscles, pectoralis minor on the coracoid process, that's right. Right, pectoralis minor, supraspinatus, infraspinatus, and teres minor on the greater tubercle of humerus, because this is the big boss muscle which is covering all these tubercles and chota mota tubercle. So it has covered this greater tubercle. So obviously greater tubercle, whosoever is attached, they all are covered. So supraspinous, infraspinous, and teres minor, they are covered, right? Then subscapularis, which is on going on lesser tubercle. So greater tubercle ko cover kiya, to lesser kya? Lesser is also covered. So that is also under that covered. Pectoralis major, that is going on that. Pectoralis minor, which is going on coracoid. Coracoid is also covered. Pectoralis major, teres major, latissimus dorsi, they are on to that bicipital groove or the intertubercular sulcus. When this is greater tubercle, right? So it will say that when the greater tubercle, lesser tubercle, so this place will also be covered. So that is also covered, right? So that's how the deltoid covers. And people feel कि अरे वाह कितना याद रहा, क्या है क्या इसमें? Right? If you just visualize and you will be able to remember it. You don't have to cram. Next is origin of coracobrachialis. Yaad aaya coracobrachialis? Yes, from the coracoid process, brachialis. Brachialis is arm. It is going towards the arm. So that सीधा साधा muscle which is coming all the way to the coracoid process from the arm, deltoid covers it. Right? Coracoid is also covered. So that is also covered. Long head of biceps brachii. Now you will laugh कि ये क्यों इतना लंबा लंबा बोल रहे हैं, right? Obviously, na, long head of biceps brachii from the supraglenoid tubercle, long head of triceps, when the entire head, right? This is the glenoid cavity. Upper biceps connected, niche triceps connected, deltoid apna boss covering whole. So obviously they will also be covered. You know? So this is long head of biceps, long head of triceps, they are also covered. Lateral head of triceps brachii from the upper part of posterior surface of humerus. Lateral part, which is coming from the posterior side, that is also covered. So, and what about the vessels? Both akapaka, right? Anterior and posterior circumflex humeral arteries. Kyun? When they are winding around the neck is under the shelter of this deltoid. So they are also covered. So something which looks so complicated, as such, if you find that it is very easy. Giving you a small homework. I'm writing it here. Your audio. Once you understand this entire thing, right? The way you spoke about quadrangular space, triangular space, and the triangular hiatus, exactly the same way, you study things properly and then speak this entire thing without watching, right? Just close your eyes and then you start speaking one after the another. So that will give you wonderful visualization. Now we are about to discuss those spaces, quadrangular, triangular, and the triangular hiatus, and you will say, "Arey, forward karo, right? There is no need." Literally, that feeling would come. So, कुछ नहीं बोलने की जरूरत. हाँ, yes.
So because all the upper muscles are attached to the deltoid, is that the reason why shoulder injury is very common?
Yes, that's right. That's right.
Okay.
That's right. So these are called as the rotator cuff muscles. It is supraspinatus, infraspinatus, teres minor, and subscapularis. Right? These are the muscles which you as such see, so they are just covering the entire shoulder. Right? These are the four flat tendons and which will be landing into the capsule. So they just cover the whole thing. There it is. Right? They are covering a whole.
Sir,
Huh?
sir, subscapularis is the muscle which is pinched most of the time while exercising.
It can. See, not all exercise. If any of the exercise, कई बार if you are using, when you go for seated dumbbell press or lying, right? And if the dumbbells, they are very heavy, तो वो वापस तो चले गए. And then when you try to push it and then you start getting severe pain. right? You will start getting severe pain. That is the point when the subscapularis is getting pinched, right? Never attempt, because एक बार ऊपर कर लिया, then that muscle would be torn. Dumbbell फेंक भी दिया, but then you start getting, that thing starts getting hurt. Another important thing,
Like
it also
pain in between the cavity, like
pain in
between the
between
shoulder and the
हाँ, exactly. And दूसरा क्या होता है, when this is done, when this is done repeatedly, तो it leads to collagen tear. So that leads to all those markings, right? Stretch marks, they start happening. So that's why it is not so that no pain, no gain, जो सब चिल्लाते रहते हैं, no pain, no gain. No, it has to be done systematically. Gradually, you start increasing the weight by not more than 5% per week. Maximum weight increase by 5% per week. You will not know that when your strength goes, it has crossed over 100 kilograms. So it has to be gradual, because you are training these muscles. The size of these muscles, now you know that they are not that big. They are itne muscles, small muscles. But because collectively they are working, that's why they are giving you this big advantage.
also tendons tends to grow
Huh.
very slow than muscles, right?
Tendons, so they heal very slowly. They heal very slowly because of the less vascularity, right? We just see that. So here the downward dislocation is common because there is no one to protect it over there. And because glenoid cavity is shallow, and we said that upper limb की तो movement अच्छे से होनी चाहिए. So that's why we are sacrificing the risk of dislocation for the mobility. It won't happen in case of lower limb, because in lower limb, the glenoid, that acetabular cavity, that is like covering the entire head essay. So it won't lead to that easy slippage, right? But over there, we want stability. Over here, we want mobility. So this is the image which you will normally be getting when you'll be learning the CT scan section. So this is like a section. So humerus is over here, right? This is a very crude diagram, but just for the understanding. This is the humerus, which is in center. And then we have, say, subscapularis. So this is the scapula, right? Scapular spine. So over here, when we are taking the section, infraspinatus, and in front there is subscapularis, correct? So this is perfect. And then we have got this area, which is the pectoralis major, teres major, and in between there is latissimus dorsi, and in this intertubercular groove, there is bicipital, biceps long tendon, right? So that is over there. This is how things are rotated, things are arranged. So here, that's like a cross section. Another one, right? When this section is passing straight away like this, right? Which is going in a sagittal, which is going into the sagittal plane, parasagittal plane, right? Parasagittal plane. So here it is the humerus, right? And this is the capsule, right? This is the capsule which is covering it, right? Because there is a joint. And then there is an outer one. In between, there is synovial fluid and the muscles are attached. So when the muscles are attached, we have got, say, subscapularis, right? Then over here, this is the acromion process. So acromion process will be on the top. So we know this humerus, we know this is acromion process. Acromion process and the humerus, and over here, this is infraspinatus, right? Infraspinatus. This is subscapularis, right? Because that is how it is coming. And in between, there is long head of biceps. So that's how it is covering from three sides. One side is open. That's why they are called as the rotator cuff muscle, right? In this, if everything is not clear, to at least focus on this. This is called as the bursa. Bursa is over here when these muscles, they keep on moving, so they lead to lots of friction. In order to decrease the friction, there has to be a cushion. So that cushion is the bursa. Bursa is nothing but a fluid-filled, well-capsulated area. So this is filled with fluid. So it acts as a cushion, right? It acts as a cushion. Now, because this is just between the acromion process and these rotator cuffs, so that's why this is called as the subacromial bursa. Subacromial bursa. This is just underneath the acromion process, right? So subacromial bursa. If this bursa it bursts or if it is reduced, right, so that gives to this shoulder tip pain, severe pain.
Sir,
And
can
this
you
is
please repeat? I didn't understand.
Hmm?
The bursa part.
Huh?
Can you please repeat it?
How can you?
Can you please repeat the bursa
Oh,
part?
okay. Bursa is nothing but, say, this is one area. It has got a capsule, and this capsule is filled with fluid. So this is a fluid structure, right? There is a fluid. It is like a small balloon, right? But filled with water, and it is placed between a bone and the muscle to avoid friction, right? To avoid friction. Name is to be given. What name should it be given? So here is the acromion process. So that's why we call this bursa under the acromion process, and that's why it is called as the subacromial bursa. Right? This is the largest bursa of the body. Big one, right? Largest bursa. In order to remember all those rotator cuff muscle, we remember it, we write it like SITS. S-I-T-S. T deliberately written small. Supraspinatus, infraspinatus, teres minor, because this is not in capital, and then the subscapularis. Right? So that is how we'll be writing. So this will be used for our revision. Right? We just write SITS in this way and we remember it. Now we talk about some ligaments. Ligaments means they are from bone to bone. So they give stability and the strength. Name, easiest thing, as the name, as the attachment. So this is coracoacromial. Knowing itself, the name is sufficient. This is the coracoid process, and this is the acromion process, right? So from coracoid to acromion, that is what is called as the coracoacromial ligament. This is the subacromial bursa. See, subacromial bursa just underneath, right? So just underneath the acromion process. And which muscle is over there? That is supraspinatus. Yes, so this is deep to deltoid muscle, and it is giving smooth movement of supraspinatus, right? So that supraspinatus is not getting, say, frictioned by the acromial process. So this is the bursa which we are talking about. The next one is coracohumeral. Coracoid process to humerus. Coracohumeral. Because all the bones are to be attached with each other. That's the main purpose. Because then muscles can work comfortably. Otherwise, so muscles will be tense. Because humerus will try to run away. So that's why those ligaments, they will be holding it, and then they'll be telling muscles, "Ke chalo boss, now you'd work and we'll make this thing moving." So here is that bursa. Now you know it, right? Deltoid is covering it. There is synovial fluid, and this is the capsule, and this is our humerus. So that is now the next one is coracobrachial bursa. बोलते ही पता चल गया. Coracobrachial. Coracobrachial means this is our coracobrachialis muscle. Coracobrachialis muscle, so that means it is from coracoid process to the arm, right? It means it will be going towards the shaft. Big muscle. So that's why एक छोटा सा packing वहां पे भी डाल दिया. It is exactly like these Amazon people when they send something, right? So this is the box. This is the box. इतना बड़ा बॉक्स आता है. You feel कि हाँ कितनी सारी चीजें आई. वो आया एक छोटा सा बल्ब है, राइट? यहाँ पे एक बल्ब आया है, बट यहाँ पे दे पुट ऑल द बर्सास, राइट? मतलब वो थर्मोकोल, सो दैट देयर इज नो फ्रिक्शन. Then this is subdeltoid bursa. Got it? No need for any explanation. Subdeltoid, deltoid के नीचे big muscle, luxury, right? So this is deep to deltoid muscle in glenohumeral joint capsule. Glenohumeral. Gleno is glenoid cavity. Glenoid cavity कहाँ पे? Glenoid cavity is on scapula. This is also called as the lateral end, right? Lateral end and humerus. So scapula, lateral end connected. So that is कि चलो यहाँ पे deltoid connect हो रहा है, put one bursa. Right? So that was. हाँ बोलो.
बरसा भी डैमेज हो सकता है क्या?
बिल्कुल हो सकता है, बिल्कुल दोस्त, बरसा तो डैमेज हो ही सकता है. एंड बरसा वुड बी डैमेज्ड व्हेन देयर वुड बी द इम्पैक्ट, हाई इम्पैक्ट. मतलब से there are many of the barsas into the entire body, plus in lower limb also. Why they say कि seat belt पहन के रखो? Because when the impact is there, that impact is so big that these बरसा दे उनका कोई काम नहीं है. And बरसा बस तो होता है, but still more serious thing is, and that is what is called as the bursitis. Bursitis. Bursitis is inflammation of bursa. And why it occurs? God will say कि वो उसमें तेरे को बरसा दिया, तो that doesn't mean that you keep on abusing this bursa, right? So you keep on using that specific muscle again and again and again. So even that bursa also starts getting friction, and one day there is inflammation, and that is very painful. Right? That doesn't go very fast. Reason? Fast जाए pain, उसके लिए we need to give anti-inflammatory. इसके पास तो blood supply it's minimal. तो blood, तो those medicines वो घूम फिर के वापस आ जाएगी क्योंकि बरसा नहीं मिला. Right? So that's why that inflammation won't be subsiding very fast. That's the reason in such cases you have to give rest, you have to give icing, you have to give compression. Just rice का E component जो है वो इसलिए so that this bursa is released from the pressure. So that is called as the rice treatment. Whenever there is any pain, especially gym में pain हुआ, so then it is you give
So
rest.
for the elevation.
Ice, right? Icing, then you give compression and the elevation.
सर तो फिर बरसा मतलब वो किससे बना हुआ किससे?
Capsule है. It is a very thin collective tissue, right? And then
तो उसके पास सप्लाई क्यों नहीं जाता?
हाँ?
लिम्फ या किसी चीज का सप्लाई क्यों नहीं जाता?
Because say this is it has got say all these areas they are having very minimal blood supply, very minimal. It is not a rich blood supply. Skin has got a rich blood supply. Scalp has got a rich blood supply. If the scalp is injured, so then it bleeds profusely, but heal भी fast होता है. So there are many of the areas in the body where there is less of the blood supply, especially when we'll be discussing the brain. Some of the areas they'll be getting very less blood supply. When they say कि शीर्षासन करो, right? When we do शीर्षासन, so obviously the gravity would help and the blood will be going to such deep areas which are normally not getting enough blood. Blood मिलता है. It is not so that there is no blood, because if there is no blood, then tissue would die. But it is very minimal blood, right? Very small vessels. Those thinned out vessels, they'll be reaching mari si आएगी. So obviously they'll supply also that mara sa blood supply. Right? Because they are not in the direct contact with the major vessels. These are all peripheral things. So in periphery, there will always be less of the blood supply. Right?
और सर बरसा में अगर कोई प्रॉब्लम जैसे कि स्टार्टिंग से ही कोई प्रॉब्लम हुआ बाय बर्थ, ऐसा हो सकता है?
मतलब कैसा?
काफी कम ब्लड सप्लाई की वजह से बरसा ही डैमेज हो चुका है काफी कम.
नहीं. Initially नहीं. Bursa is always damaged because of repeated movements. वो पता है टेनिस एल्बो कहते हैं. Then in cricket, वो मतलब they get the shoulder pain. Then those table tennis players, right? They get that pain. So it is by the repeated movement. Bursa जो है, as such, it is a very strong thing. बना इसके लिए है. But when that muscle keeps on working, moving, so that finally this bursa gives up. कि बस मेरी capacity खत्म. Now I am injured. Right? So that's how it gets injured. Normally, say bursitis, it occurs in athletes when there is repeated movement. Especially say, for example, when we run those full marathons, होता है pain. Right? The pain starts in the ankle. The pain starts in the foot. When we find it difficult to foot flex भी नहीं हो रहा, so then what's the solution? On the aid stations there is ice, बर्फ रखा होता है पानी में. Right? Just put 1 foot, 2 feet, both feet into that bucket, रखा पाँव, and then बाहर निकले, भागना शुरू कर दिया. Because that thing, that icing, this is called as the rice. Rest तो possible नहीं है रेस में. Icing is possible. You can do compression, but that we already do by wearing those compression socks, right? So that the soleus is also contracted properly, so that you don't develop the varicose veins. And then elevation is also not possible. वो तो जब रेस खत्म हुई, then वो पाव ऊपर करके रखा, so that the drainage, venous drainage comes back. ये इसलिए because gravity will keep on pulling the blood. Muscles are using the blood so much, right? So muscles feel like कि मुझे blood वापस नहीं भेजना. So there will be accumulation, there will be pooling of the blood. That's why whenever you are buying any of the shoes, say for example, my number is 9.5, right? So when I buy the marathon shoes, so I got a different pair of shoes for marathon, different pair of shoes for half marathon. Half marathon is 21 kilometers. So in that, the rule is just go for 0.5 size above. So you go and you wear 10 number, 10 number ka juta for half marathon. That means 21 kilometers. If you are supposed to run marathon or ultra marathons are more than 50 kilometers. So in that, you need to go for 10.5 because you know that there would be swelling in the feet. In spite of that, you have to run. So that's why you are giving space for that, right? So this is how the shoes are to be selected for marathons and half marathons and obviously the ultra marathons. Okay, this is, I need not teach. Quadrangular space, so superior, inferior, medial, and lateral, you know all those things, right? Subscapular is in front, capsule of the shoulder joint, inferior border of teres minor. This was the audio which you are supposed to speak, right? So those who are not done, they can go for this, right? Axillary and posterior circumhumeral vessels, they are passing through it. This is what we learned, that in order to remember it, just put 2 fingers like this, 2 fingers like this, and then this finger will be going anteriorly. So this anterior finger, this is teres major. This one is the teres minor. And out of these 2 fingers, this one is the lateral and this one is the long head of triceps. And now you have created in between, this is quad space, above is triangular space, and below triangle is called as the triangular hiatus. Here it is. And along with the names, right? So this is the lateral triceps, lateral head of triceps. This is the long head of triceps. That's the teres major, and this one is the teres minor. Right? Quad space, triangular space, and the triangular hiatus or the interval. Same thing, just shown with the muscles, right? You can, this is teres minor, this is teres major, this is long head, this is lateral head, and that's the humerus. Right? Same thing shown individually, right? Teres minor, teres major, humerus, long head of triceps, you know this. We are talking about quadrangular space. We are talking about quadrangular space. Same उसी में you were able to watch this, both the triangular space and the triangular hiatus. Quadrangular space, yes, axillary nerve. This is axillary nerve is passing through along with plus posterior circumflex humeral artery. Yes, we have already seen that, right? This is the axillary nerve, which is part of posterior cord.
Posterior cord.
That's right. Then we have got the axillary nerve, which is passing through, right? This is the posterior view. This is the axillary nerve. Surgical neck, when we say like that. So no need, right? You know this upper triangular space, superior, lateral, inferior. This is teres major. That is the inferior. Then superior is teres minor, and lateral is medial border of long head of triceps brachii. This all you have spoken. Let's say how easy it becomes. And it is circumflex scapular artery, and which goes on to the opposite side. Anastomosis, we are just coming to that. Right? This is the lower triangular space again. Medial, lateral border of long head of triceps brachii, lateral medial border of humerus, and superior is the lower border of teres major. Right? What it consists of? It consists of radial nerve, so that it will be forming the groove, and it will be accompanied by profunda brachii artery. Right? Profunda brachii vessels, artery and vein, both. But this is profunda brachii. Profunda is profundus so much. Brachii means arm. This will be the artery. So here, this is the muscle, right? This one is the muscle, this one. That muscle we have made transparent so that we can see the things which are passing through it. So what we are watching is we are watching humerus. There is a teres major, and then there is long head of triceps, right? Long head of triceps. That's how it makes, right? And then there goes the radial nerve, right? It goes anterior to posterior. So that's why we'll be finding on the posterior side the complete groove. So this will help us in identification which side is anterior, which side is posterior. Right? So this would be the important landmark. Here it is, right? Radial nerve. That's the radial nerve. And then there is ulnar and the median nerve. They are going सीधा, right? So this is ulnar. Ulnar kahan se aayi? Median kahan se aayi? Median nerve, you know that it will be made by the median and the lateral root, which will be coming from. That's right, cords, respective cords. Perfect. And this ulnar nerve is from
Medial cord.
Median.
Very good.
Medial.
So yeah, this you know. And now we have added, the entire group is remain same. We have just added the profunda, right? So here it is. We have added this is the radial nerve. It goes anterior to posterior, and the branch of brachial artery is profunda brachii artery. Here it is. It is joint venture as a collection. It is both the things they are going together. Right. This is axillary artery. Just sort of a revision. Axillary nerve. This axillary nerve, which is going back, right, along with posterior circumflex humeral artery. So that's this one, posterior circumflex humeral, and this one is the axillary nerve. All right. So axillary nerve, anterior branch is accompanied by posterior circumflex humeral artery, and this is called as the surgical neck, right, which we are singing since long. So here it is. And it is deep to deltoid. So obviously, right, this entire area will be covered by deltoid. So it is not obvious. That's axillary nerve. Posterior branch supplies the teres minor and the posterior part of the deltoid. This is the nerve, right, which is supplying teres minor and posterior part of deltoid. This also gives superior lateral brachial cutaneous nerve, superior and lateral cutaneous nerve for the brachial part, arm, right? These are all now the terminal branches, small branches. Now this is anastomosis around the body of the scapula, right? So much is written, right? And you go crazy. The anastomosis occur in three fossa: subscapularis, supraspinous, infraspinous, formed by suprascapular, branch of thyrocervical, deep branch of transverse cervical. कभी याद ना रहे, नहीं पढ़ना ऐसा. Let's do one thing. और easy कर देते हैं, right? Still easy. I've drawn one more figure. ये कुछ नहीं देखना. No, we don't want to see anything. ये भी नहीं. ये भी नहीं. We'll come back. ये भी नहीं. Let's come to this. This would be a sort of revision आज तक जो किया सबको. It's so many messages. Okay, you do that exercise as warm-up. अच्छा है. If you're doing it as a warm-up, start with low weight and then increase it. Low blood supply, low contraction. Yeah. Klumpke's palsy and Horner syndrome. Okay. I'm not very much unwell, but habit. I mean, when these people, they grind, right? So then there is so much of dust. So that dust, when it goes into the lungs, it causes some problem. Minor problem. Chalo. This is the figure which this again is in the homework. Homework mein kya? You have to draw this thing. वो छोटे बच्चे को दे देना 5 बार लिख के आना. Draw 5 times. Draw. Okay. Without watching, huh? 5 बार without watching. So whatever the practice you want, you do it. But then you'll be drawing it 5 times without watching. 3 times single shot. Then give a break of 6 hours. And then draw another 2 times. Better this before sleep. Before sleep. And see, tomorrow you'll be the masters. Right? Chalo. Here it is. Subclavian. Okay? Subclavian. Acha, at points, you will find that I've used blue color, kahin pe red color, kahin pe black color. No, all are arteries. The color has been changed just for the differentiation, right? Otherwise, all are arteries. So here it is, the subclavian artery. That subclavian artery, it comes out, right? Basically, it is a brachiocephalic trunk. Brachiocephalic trunk, it comes out, gives one branch, which is going up, and that is the right common carotid artery, right? Gai upar. We don't want that thing. There is one more, which is the vertebral artery. Okay, wo bhi brain ke liye gai. Fine. Now this is the subclavian artery. The subclavian artery, as it moves, the first thing which it gives is that एक branch नीचे गए, and that is the internal thoracic. ठीक है? Internal thoracic. One which goes above, this is the internal thyroid, which will be supplying to thyroid. So right now we don't need it. There is one which is called as the transverse cervical, this part, transverse cervical. And this transverse cervical will be giving one branch. Right? So keep in mind this. So this is the area of our interest. One branch which is coming out from the subclavian, right? And that is transverse cervical, that one. Second one is suprascapular, right? Suprascapular, we discussed about this. So suprascapular is there. So collectively, all of them, they are thyrocervical trunk, right? So done. Apna thyrocervical trunk is done. Very less is left out. So subclavian, apart from this common carotid and vertebral, one is the internal thoracic, which is going down, right? So wo niche. And this is the thyroid, transverse cervical, and the suprascapular. They are making this thyrocervical trunk. Thyroid and the cervical trunk. That is done. The next one, this blue one, that is going up, and it is called as the costocervical. Costocervical because it is giving deep cervical and superficial intercostal. It is going deep cervical and the superior intercostal. Done. This much is which is coming from subclavian. Subclavian, as it crosses the rib number 1 edge, and we change the name. We now start calling it as axillary artery. Axillary artery, it is the pectoralis minor, this muscle, pectoralis minor, which tells that I'll gracefully divide this into 3 parts, first part, second part, third part. First part has got 1 branch, second part has got 2 branches, and third part has got 3 branches. The first branch, which is a very simple branch, just squeezes, this is superior thoracic, and that is what is going there. Done. Second part, it has got two branches. Out of those 2, one is very easy. This first one was internal thoracic, so then this is called as lateral thoracic. Right? Lateral thoracic. So we have got internal thoracic, we have got the superior thoracic, we have got the lateral thoracic, right? So thorax is getting blood supply from top. But we are interested in this thoracoacromial trunk. This one, thoracoacromial trunk. Thoracoacromial trunk is what is giving APCD. So this is the acromion. This is pectoral, clavicular, and the deltoid. So these are the branches which are coming out, right? So here it is. So our first branch of interest was, right, this, right, this one, the suprascapular artery, right, suprascapular artery. That was our first artery in which we were interested. Then second one, the deep branch of transverse cervical artery, right, that was our area of interest. And the third one is, as we go down, right, see, these were the branches. The third one has got three branches. One is the subscapular and the anterior and the posterior circumflex humeral. This we are not interested. We are interested in this third one, right? This third one. So this is the circumflex scapular artery. So we have got axillary artery, the third part, right? That is the circumflex scapular artery. These three will be making what is called as the link between subclavian artery and the third part of axillary artery. So subclavian artery and third part of axillary artery. That means this entire portion which is in between, it is skipped. So that is the anastomosis, right? Now when you go back, and try to read this, you'll find it makes sense. The suprascapular artery, a branch of thyrocervical trunk, right? Right, thyrocervical trunk. The deep branch of transverse cervical artery, another branch of thyrocervical trunk. So ये आई ऊपर से. And the circumflex scapular artery, a branch of subscapular artery which arises from the third part. So this is done, but that's where the anastomosis. So two major they are coming from, because the subclavian is bigger one, right? So two branches they are coming from the top, one branch which is coming from the axillary third part, and they make anastomosis. This anastomosis between branches of the, that's the key thing. The first part of the subclavian artery and the branches of the third part of the axillary artery. Done. This is over, right? Now all these descriptions, they are related to that only, right? This is where we see that suprascapular artery, yes, which is coming from the branch of thyrocervical trunk, right? Here it is. This is another branch which is just going down. This is subscapular, right? And that's how it communicates. We drew this, right? So here it is. The three branches, we now see it into our sample. First one, which was that acromial suprascapular artery. So that, right? Now this is the suprascapular artery. The second one again at the acromial, thoracoacromial artery. Okay, thoracoacromial, right? Acromial part or the acromial branch. And this one, which is just onto the third part. This is the third part, right? From there, posterior circumflex humeral artery. So this is posterior circumflex, but posterior circumflex will be meeting anterior circumflex. But in that, it will give one branch above, and that is the acromial branch, which will go above. And this is the artery which is responsible for the anastomosis between subclavian and the third part of axillary, right? So this artery is the crucial one. Now quickly, we just go through some of the ligaments. In fact, this is one Viva question. You'll be asked about what is superior transverse scapular ligament, right? Kuch nahi. There is scapular notch. There is scapular notch. Anything which is like this, it is called as the notch. Next time, we'll be watching only the bones. So you'll be watching this. So this is the scapular notch. If this notch is converted to foramen, right? Notch is converted to foramen by this ligament. So this ligament will convert it into foramen. I zoom this thing. think that there is one nerve here, there is one artery here. Getting it? So this artery is above and nerve is below. So think it like artery is above, so army is above and navy is below. And finally, we talk about this conoid ligament. Pretty complicated it looks. So that's why keep it aside for a while and we watch this image. This one image will tell you every part of it. So first, acromion process, we know this acromion process. Coracoid process, we know this coracoid process. So let's connect these two, right? Acromion and coracoid connected. So, right? Coracoacromial ligament. So this is done. Now, that's the clavicle and then the acromion. So here, what name we give, right? So this is superior acromion. This is acromioclavicular, right? So that's why we name it as acromioclavicular. And then there is one more, which is big one, right? This one is between coracoid process and clavicular. So we name it as coracoclavicular. Coracoclavicular ligament. Okay? Coracoclavicular ligament. This coracoclavicular ligament it has got two parts. One is conoid, one is trapezoid. So this big portion is called as the trapezoid. And in clavicle, we'll see there is a conoid tubercle. Conoid means very small tubercle, right? That is where it will be small portion will be attached. So that is called as the conoid part. So thus conoid or trapezoid, they are part of the coracoclavicular ligament, out of which trapezoid is bigger. So these are the important ligaments, bone to bone. Everything done. That's it. Right? So 2 homeworks given for today. And it will take some time, but definitely this time I hope that you'll be sending it. All right. Thank you so much.
Thank you, sir.
And we meet very soon.
Thank you, sir.
Thank you. Bye-bye.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thanks.
Will you please tell again what kind of audio we have?